Okay, this patient came in with left-sided facial pain and swelling, and in the emergency department they ordered a CT scan. And so I'll scroll up through the mandible, and right away you can see that there's a problem. You have a periapical radiolucency with an overlying cortical dehiscence. And then you have soft tissue swelling right here. So let's go to soft tissue windows and see what this looks like. So if I scroll to that area, you've got all this edema and soft tissue swelling. You can see that there's reticulation of the fat right here, which is essentially, it's called fat stranding or edema in the fat. And then over here on the right, that fat looks nice and clean. So clearly there's inflammation. There's no discrete fluid collection, except for right here, this crescentic shape subperiosteal fluid collection. So I would call that a subperiosteal, small subperiosteal abscess with overlying phlegmonous change or cellulitis. So this patient actually, for some reason, had an MR of the face done with contrast. I am not sure why. Perhaps they couldn't figure out that it was the tooth causing the problem, or maybe they got this study first. I'm not sure. Let's see if I can get a good... Here is a fat saturated fluid sensitive sequence, so you can see that the fat is really dark. This is normal fat. And then over here, there's bright signal in the fat. And again, this is more edema or fluid within the fat. So you don't normally get MRs for this type of facial infection, but this is what it would look like. Now, they did get oral surgery involved in this case, and oral surgery ordered this panoramic radiograph, and the problematic tooth was this left mandibular second premolar, and there's a periapical radiolucency, there's coronal lucency, all compatible with decay. It's just very interesting to me that when a patient comes to the emergency department, they get labs drawn and blood work, and they get CT scans with contrast, and sometimes an MRI of the face. And if they had just gone to a dentist and oral surgeon, they probably would get this one radiograph and an extraction. So it's just the nature of our healthcare system. In the emergency department, this probably cost $10,000 for what could have been just a $100 simple extraction. But it is a good educational case. It shows what decay looks like on plain radiograph, on CT, and you can't see the decay on the MRI, but you can certainly see the surrounding edema within the facial soft tissues.